Hello everyone, you're welcome to Akoko Africa Radio UK, and this is Health Talk with Atswei. Thank you for staying with us. We are late as usual, we are always late, but we'll do our possible best not to be late next time. Today we have Geraldine coming back, and the topic we are treating is pain management. I hope you stay with us and learn something out of it, and prepare for your questions. She's here, and you know her, she's always there with quiz as well, so she will quiz us at the end of this, so just pay attention and be ready to answer your questions. Before we continue, we'll get a message from our sponsors, and then we come back and continue. Thank you.
When it comes to balloons and balloons decoration for your baby Christian, for your ceiling floral, You Smile is the place to be. For your wedding setup, your beautiful wedding setup, backdrops, and everything when it comes to planning, coordinating, and delivery, You Smile is the best. For your indoor programs, for executive programs, for corporate events, You Smile is the place to be. Call on us and we shall give you the best of services. Our telephone numbers are 0242571571 and also 0243639381. Our social media handles are IG You Smile Events, on Facebook You Smile Events, and also on TikTok You Smile Events. Come and let's do business, and you never regret it. You Smile. Satisfaction is our hallmark. We'll make sure we deliver, and our delivery is always on point. When it comes to balloons and balloons decoration for your baby Christian, for your ceiling floral, You Smile is the place to be.
Hey there, fabulous folks. Are you ready to take your locks to new heights of beauty and vitality? Then listen up, because Tiny Hands Locks is here to make your hair dreams a reality. Located at the heart of natural beauty, Tiny Hands Locks isn't just a salon, it's a sanctuary where your locks are pampered and celebrated. Now, let's talk about our top-notch hair care services and products. At Tiny Hands Locks, we believe in the power of nature's bounty to nurture and revitalize your locks. At Tiny Hands Locks, we are dedicated to crafting bespoke lock styles that enhance your natural beauty and reflect your unique personality. From starter locks to locks maintenance, we've got you covered every step of the way. And when it comes to products, we've curated a range of natural wonders that are sure to leave your hair feeling pampered and rejuvenated. From clarifying shampoos to revitalizing conditioners, each product is meticulously formulated with nature's finest ingredients to cleanse, nourish, and protect your locks. But wait, there's more. Visit our website at www.tinyhandslocks.co.uk to explore our full range of services and products. Located at 24 Swan Close, Feltham, TW13 6PA. Just give us a call at 0783 298 9531 and we'll take care of the rest. So what are you waiting for? Treat yourself to the luxury and care you deserve with Tiny Hands Locks. Because at Tiny Hands Locks, we're not just about hair, we're about empowering you to embrace your natural beauty and shine from within. Discover the magic of Tiny Hands Locks today. Hey there, fabulous folks. Are you ready to take your locks to new heights of beauty and vitality? Then listen.
Hello, welcome back. So like I said earlier, today we have our beautiful Geraldine here, and she's coming to treat pain management. So anything got to do with pain, what kind of painkillers you need to take, when to take and when not to take, and how to manage it. I'm going to welcome you. Welcome, Geraldine.
Thank you. I'm happy to be back.
Thank you so much for coming here again. We've been waiting for you for a long time. It's always nice to have you here.
Thank you.
So, straight to it, we are already late.
Mm-hmm.
We want to know why this particular topic? Why pain management?
So when I was thinking of what I could discuss, I was thinking of something that, you know, again, affects a lot of people, different ages, different races, different gender. Like pain is something we've all suffered. And working in healthcare, pain is often reported, you know, from children to adults, and managing it can be quite complex. So I tried to do a bit of reading and more learning and understanding of how to manage pain, because the answer isn't always medication. So yeah, that's why I decided pain management today.
Oh, thank you. I know it's a very good topic because we know we Africans especially, we like to take pain killers whenever we feel anything, like paracetamol all the time.
Yes.
Yeah. That's a good topic. Okay, so please can you explain to us the concept of pain to us?
Okay, so by definition, it's an unpleasant sensory and emotional experience associated with, resembling that associated with actual or potential tissue damage. Pain is always a personal experience. It's very hard to describe. It's not always easy to describe, shall I say.
Yeah.
Everyone's tolerance is different. So how I measure pain is different to how you measure pain. And our life experiences, individuals learn the concept of pain as you go through life. You learn what is painful, what isn't, how much you can tolerate, how much you can't. So sometimes the pain is just obvious. If you were to sprain your ankle or break your leg, you know, that pain is evident. We can see what's happened and we can imagine what the person's feeling. But there's also pain that we can't see, emotional, psychological, but also within the body. If you've got something like a slip disc in the spine, we can't see it to the naked eye, but we know that that can cause severe pain. So how pain works is, imagine the body as like one big computer. So there's this huge network of nerve fibers going to the spine and then leading up to the brain. So these nerve fibers work to tell the brain, this is painful. So we have different categories of pain. We have short-term pain, which is also called acute pain, and that's what I was telling you. You sprain your ankle or you burn yourself, that's short-term, it's considered acute. Then we also have chronic pain, which is long-term, normally pain that lasts more than 3 months.
Okay.
And that's when it starts to go into the category of chronic pain. So when pain starts off acute, it's telling us that something is wrong. So you burn your finger here, the signals travel through the body into the spine up to the brain to say that hurt. But sometimes those signals can go wrong, just like in a computer. If one thing was to go wrong, it can just throw the whole computer off.
Yes.
And unfortunately with the pain network, you can't just reboot it. So another way of thinking of it is, the pain starts at one point. So imagine you're at a football stadium and one person starts chanting, and then before you know it, the chant has spread across the stadium and
Everyone is chanting.
Exactly. So that's how the nerve fibers work.
Okay.
One area is damaged, and then the signal travels across the network to say this is pain, and it travels. So when it goes into that chronic and persistent pain, it's gone past telling the body that, so it's gone past telling the brain that this is painful. It's now unnecessarily, the network is now unnecessarily being disturbed, so the signals are now just firing off, and there's no direct message. It's just a generalized, I'm feeling pain.
Okay.
So part of this process is that the messages can get confused, and then the brain cannot understand the signals anymore. So this is chronic pain.
Okay.
And this is what we're going to dive more into, understanding that long-term pain. Because it may be that that area of the body, the pain, it's got nothing to do with that anymore. Now you're just needing treatment for something you no longer can figure out. So yeah, that's
okay. Wow. Because whenever I go to the hospital with pain, I remember I once went with stomach pain, and then they ask you between 1 to 10, on the scale 1 to 10,
yes,
how painful. I always ask myself, how do you know? And I always go for 20. Even though I'm giving 10.
You just want to get the message that I'm in pain.
Yes.
Yeah.
Yes. So, thank you.
Yeah.
So how common is chronic pain?
Chronic pain is very common. Chronic pain, it's said that 1 in 5 people suffer from moderate to severe chronic pain. 1 in 3 are unable or less able to maintain an independent lifestyle because of that pain. And 1/2 to 2/3 of people with chronic pain are less able or unable to exercise, enjoy sleep, walk. So it's quite a large number of people that suffer from chronic pain. And working in the surgery, almost every other phone call is to do with some form of pain and needing help with it, or we've tried several medications and they're not working. So yeah, very common.
Wow. Well, hello everyone, we are still here on Akoko Africa Radio UK, and we are on Health Talk with Atswei, and we have Geraldine here talking about pain management. So far we've learned something about chronic pain, what causes it, and how common it is. So Geraldine, what are some of the risk factors for pain?
Risk factors? So we start with the demographics. Women are actually more likely to experience chronic pain than men. Over the age of 45 years old, you're more likely to go into that chronic pain category. So when you think about it, young children, it's very rare that they will tell you, you know, my back is hurting for more than 3 months. You know, it's definitely age related, and your socioeconomic status as well. So where the kind of job you do, so if you're a labourer, unfortunately you're more likely to enter that chronic pain group. Also lifestyle factors, so cigarette smoking, drinking alcohol, inactive lifestyle. So, you know, again, in work I'm seeing 80 to 90 year olds that are so active, and on paper they've got these conditions, but because of their level of activity and how they keep the body moving, their joints moving, etc., etc., they don't complain about chronic pain. They may get that acute pain from time to time, and they'll take something short term, but they won't be calling every other week saying I'm still in pain, because they remain active. So an inactive lifestyle puts you at risk.
At risk, okay.
Yeah. Clinical risk factors are multimorbidity, which means you suffer from many conditions. Psychological distress and pain-related disabilities, of course, will put you at risk. Those are the main risk factors.
Okay.
Yeah.
So movement or exercising or just a normal walk can help to improve. Okay, thank you.
Of course, there's things like pregnancy and things like that we go through. But again, that wouldn't be, I mean, some people, pregnancy would be acute on its own, but then where it can enter chronic is if, you know, something was to happen during labor and things like that, something to your back or something to your to the woman's private area, then it could enter that chronic pain.
Okay. Thank you. So how should we assess someone with pain?
Okay, so when they originally come in, you first need to identify red flag symptoms.
Okay.
So kind of like warning symptoms that this is more than just pain, this could be entering something else. So how I like to check that is abdominal pain. If they come in talking about a stomach hurting and things like that, don't just disregard it as stomach ache. Ask further questions. Are they getting persistent vomiting? Is the woman in childbearing age? Have they had to go A&E quite often because of the stomach pain? Is the pain associated with a fever? Are they sweating? Is there chills? Unexplained weight loss. So, you know, you're in pain, but then you've also been dropping weight at a drastic rate. You know, that's something to investigate, because it may not just be the pain you're describing. There could be a condition going on in the background. Persistent bone pain and pain that worsens at night as well. If they say, oh, you know, I'm fine in the day, but the minute I lay down, the pain is a lot worse, that's considered a red flag symptom.
Okay.
And then from there, if you can rule out, you know, if you can rule out those red flags, you move on to something. You take a full medical history. So we use an acronym in healthcare. I don't know if you've heard of it. Socrates. Yeah. So that's the acronym we use, especially when it comes to pain. So someone comes, and you first ask them about the S.
Okay.
So the site, where is the pain? The O, onset, when did the pain begin? The C, character, describe the pain. Sorry, I have to remember how to spell it. R, does the pain radiate? You know, if someone was to come in to the surgery or a pharmacy, say, oh, I've got a pain that's starting in my chest, but then it's radiating down my arm. That could be someone having a heart attack right in front of you, or the beginning of a heart attack in front of you. So it's important to ask, does the pain radiate anywhere else? Timing, has the pain changed over time? How is it on and off? Is it every day? Is it every minute and then it stops? It starts again? And exacerbating and relieving factors. So is there anything you do that helps the pain aside from medication? So is it better when you sit down? Is it better when you stand up? Is it better when you walk slower? So that's the Socrates. And the S is oh gosh, where's the S? The S is severity.
Okay.
Severity is what you described. So when they ask you from 0 to 10, how painful is the
20.
pain? You give them that 20. So yeah, definitely go through Socrates. It's helped me a lot, making sure that I've asked all the right questions, and that even you as a person talking about your pain, it helps you kind of remember, explain it better, because like I said, pain is hard to explain.
It's true.
So it helps break it down. And then of course you can do further investigations like blood tests, X-rays, and within the blood test, you would want to look for things that, you know, are looking at your cancer screening, C-reactive protein, which shows if there's infection, full blood count, and thyroid, looking at things like that. And then you're looking at your scans, your X-rays, MRIs, ultrasounds. That's if you've got that equipment. But that's just extra.
Okay.
Yeah.
All right. Thank you very much. Moving on. So how do we begin to manage the pain?
Okay. So after you've assessed the patient and they've described everything to you, you've gone through their medical history, you begin to decide the best approach. So you try and involve the patient in their treatment and consider their ideas, their concerns and expectations of treatment. You measure the severity and the impact it's had on their life and activities. You try and figure out the cause of the pain and whether there's been any deterioration. And then you look into the different treatments and make sure you're offering the correct, but always measure the benefits and risks of medication. So there's the pharmacological approach and there's the non-pharmacological approach. Most common, as we know, is the pharmacological, which I know we're going to talk more about.
Okay. All right. We are still here on Akoko Africa Radio UK, and we are on Health Talk with Atswei. So, Geraldine, can you explain to us the different types of pain medication?
So, pain medication comes under something we call analgesics, and it's split into a group of opioids, so your opiates and your non-opioids. And we start off normally with paracetamol, and that's the most commonly used painkiller. Yeah. And widely available, very cheap. In healthcare, we actually ask that patients start there and build up because it has the least side effects. It can be used as young as 2 months.
Okay.
Yeah. Paracetamol can be used in a 2-month-old and older. I know in hospital they may even go younger, but that would be in special cases.
Okay.
And then you have your opioids, which is they're also popular, but your codeine-based products, your morphines, your tramadols, and your buprenorphines, the strong stuff. There's increasing awareness of the adverse impact of opiates. As we know, there's opioid crisis in America, but there's also opioid crisis in Africa, unfortunately, with the availability of things like codeine and morphine that are just readily available to buy. People don't necessarily understand how they work, and they don't understand the risks of addiction, but not just addiction, tolerance.
Yes.
If you take something like that long enough, your body starts to, so you start at 0, you introduce the medication to someone, and their level of tolerance, if they continue to take it, starts to build. So now something that was 10 milligram of morphine is now their new 0. 10 milligram won't do anything for them. Whereas,
they need more.
Yes, they'll need more and more and more. So with that comes more side effects, and not just side effects, risk of death, because they're looking for that pain control, but their 0 keeps rising and rising and rising because they haven't taken any breaks. They're just teaching the body to tolerate it and become almost unresponsive to the medication. So opiates are very, very important to be
This is
aware.
like the antibiotic issue.
Yeah, that's the thing. It's that people don't know these medications. Yes, they can be very helpful, but they can literally be the difference between life and death. So when mismanaged, and we'll discuss that further. There's also what we call adjuvants, which is medication you can introduce at any point. So if you are on an opiate or a non-opiate, you might add something in like your neuropathic medication, so your pregabalin, your gabapentin, anticonvulsants, your amitriptylines, and things like that. They work slightly different, but I can explain that later as well.
Okay.
Also, you've heard of anti-inflammatories, your NSAIDs, your non-steroidal anti-inflammatory drugs. So that's your ibuprofen, your naproxen, your diclofenac. What's commonly used back home? Ibuprofen.
Yeah.
I mean, out of all the anti-inflammatories, ibuprofen's probably the safest.
Okay.
But still carries a lot of risk when mismanaged as well. But I'll talk about the side effects as well of that
I think
later.
they do have diclofenac as well.
Yeah.
I think,
That one.
Naproxen is not so common, but I think with prescriptions from hospitals, but over the counter a lot is ibuprofen.
A lot.
Yeah.
See, diclofenac here, we don't even use it on prescription much anymore here because they discovered that it had cardiac associated side effects, so it's starting to affect people's hearts.
Oh, okay.
So I don't even know if that has reached back home, that understanding. If people are still selling it to people, it's so dangerous. So yeah, diclofenac isn't commonly used, and it shouldn't be used much. Yeah.
Wow. Wow. So there you are. If you are buying medication over the counter, especially in Ghana or any other African country, we always get medication with our prescriptions. You have to be very careful what kind of medication. And she's saying about diclofenac. Please don't buy, avoid it. Avoid it at all costs. And if you are still in pain, go and see your doctor to get a proper prescription. Okay.
So I actually wanted to talk to you about the World Health Organization pain ladder. We call it a pain ladder. So there's step 1, 2, and 3.
Okay.
So someone comes in associated with pain, like I told you, the first thing we would prescribe is paracetamol. But even paracetamol, I don't know if you're aware, under 50 kilograms, you're not supposed to take the 4 grams daily. You know the usual dose of 2 tablets 4 times a day? Yeah. If you're under 50 kilograms, that dose is reduced depending on your weight as an adult.
So we the fat ones you can have more, is it?
Yeah. See, I used to just tell adults. I mean, it's hard to be under 50 kilograms.
As an adult.
Yeah. But I used to tell adults, just take your 2 paracetamol 4 times a day. Not even, especially if they were elderly, I'd be like, that's the safest thing for you to take. But obviously, as you know, elderly people tend to lose weight in their older age and become frail. So we're not even assessing this person. We've just sent them away to take 4 grams of paracetamol, and we're not assessing our
weight.
And paracetamol itself, it works through the liver. It works through the liver, and it also affects the kidney. So you're giving someone an overdose. They're already frail and older. You could be risking their health essentially if you don't know that about paracetamol. So you start with your paracetamol, then if that's not enough, of course you can add your ibuprofen.
So the paracetamol, the 2 4 times, is it the maximum, or when you are fat like me you can take more?
No, the 2 4 times is definitely the maximum. It's the maximum.
Okay.
No, don't go beyond that. And then in part of step 1 is you can add your anti-inflammatories, so your naproxen, ibuprofen. Assess why you're prescribing ibuprofen. So earlier with chronic pain, I didn't mention, things like neuropathic pain. You do diabetic foot checks, isn't it?
Yes.
Yeah, so people suffer a lot from pain in the feet or the extremities because of their circulation. The diabetes has affected it.
Okay.
And so if something like ibuprofen wouldn't work for that kind of pain. So it's important to know why you've added the ibuprofen. That's more associated for muscular or joint related pain. Ibuprofen's effective, and if there's fever or things like that, ibuprofen can help as well.
Okay.
Ibuprofen, always be careful. As we know, it can predispose you to ulcers and stomach bleeding. So always be careful with your ibuprofen. Then step 2 is what we call the weak opioids. So why we call it a ladder is that you never really get rid of the paracetamol. That's always should be your baseline, and then you add other medications on top. With paracetamol, you don't need to worry about addiction. You don't need to worry about tolerance.
Okay.
All the things I mentioned with the opiates. So paracetamol is always your baseline, and then you add your ibuprofen to your paracetamol. Then you can look at weak opioids, so your codeine at lower strengths, dihydrocodeine, your tramadols. You'd add that at stage 2. Assess, always assess, is this working? Do not just take it to take it. And step 3 is when you look at your stronger opioids, so your morphine, your oxycodone, your methadones, your buprenorphine, your fentanyl. So yeah, it's a build-up. You're building on top of each other.
Okay. Wow.
Yeah.
So with this was you just can't just get up and be taking it by yourself. You need to see a doctor to go through these steps.
Yes.
Okay.
Yes.
All right. Thank you. Okay. So what are the side effects? What are the different side effects of the different medications, pain medications?
So as I mentioned to you, it's very important to assess, is the pain that you were talking about being helped, or has it gone more into risk over benefit? Paracetamol, like we know, you can buy easily, metabolized by the liver, but it can become toxic in overdoses. I mentioned the dose adjustments. With that one, it's very low side effects. That's why you can administer it in a 2-month-old. You don't need to worry about side effects with that. The NSAIDs, the anti-inflammatories, you make sure that you're monitoring for any kind of change to the gastric system. So if someone says, I've been taking this ibuprofen, but now I've got a dull ache in my stomach, you would begin to worry. So making sure that you eat before you take it on a full stomach. For some patients, making sure you prescribe a proton pump inhibitor, so your omeprazole, your lansoprazole, to protect the stomach.
The stomach, okay.
Yeah, because if you've got a history of ulcers, even on a full stomach, you're more at risk of developing them.
Yes.
So you might need that extra protection. So your lansoprazole can do that if this is the medication that you need to take.
Okay.
NSAIDs can, people don't even know, in asthmatics, it can cause bronchospasm. So when we're reviewing asthmatic patients, we always check, do you buy ibuprofen over the counter? Make sure you're careful, because you can actually have an asthma attack. It could cause, I mentioned bronchospasm, which is basically within the lungs, the bronchioles, they tighten up and the patient struggles to breathe. Ibuprofen interacts with a lot of medications, your blood thinners, so it can cause severe bleeding, internal bleeding. Your antidepressants, it can interact with. So always just be careful, if your stools have gone darker, if you've developed that stomach pain, get checked out or speak to someone in healthcare. With the opiates, that's where the list of side effects comes and the complications, the codeines, the morphines. Common side effects is constipation. Yeah, and we're very, especially in the UK, I've noticed we're very guilty of doing it to bedbound patients, because these are the kind of medications that are often prescribed in cancer, things like that. They're the only ones that can touch that pain or help that patient with pain. But if they're not mobile, if they've been laying around all day, and then you're going to add on constipation, it's extremely uncomfortable. And drowsiness, severe drowsiness. So there's even some of them, if you're taking it, you're not allowed to drive or operate heavy machinery. Nausea and vomiting is very common. I think I took cocodamol 30 milligram with 500 milligram paracetamol. Oh my gosh. I did it at work in a moment of desperacy. I was in a lot of pain, and the man I was working for, he said, you can just take some Zapane. We call it Zapane. And I took just one. Oh my gosh, I felt like I could just project out everywhere. I was like, how do people take 8 of these a day?
Like me.
Do you take 30 milligram?
Yeah.
Wow.
But then I actually take it twice a day. I don't take 2-4 times.
Oh, you don't take all 8?
So it's morning and evening, yeah.
Oh,
unless I'm in very, very serious pain before I take. Yeah.
Okay. But can I ask, how did it start? How did,
so
when you first started taking it?
When I first started taking it, like, I was feeling sleepy and drowsy all day, and all you want to do is to sleep. But now, nothing.
Okay.
Yeah.
Okay.
I realized that when I rather take it in the morning, I become more active, like I've taken my coffee.
Oh.
And then when I take it in the evening, I tend to sleep. So
okay,
for some reason, it's working Some.
And have you always remained at the same dose?
Yes.
Okay. And
I was actually prescribed 4 times, but I never took
Took that
because I was worried about getting addicted to it and all those things. So I try to take. In fact, there are days I take just in the morning.
Okay.
And I don't take in the evening unless I can't deal with it. Yeah. And then other days when I feel I need it, I go buy the lower dose over the counter and take that in the evening.
Okay.
Yeah.
Okay. And that's why I think you've probably managed your tolerance.
Yes.
Because you haven't taken the maximum dose for a long period of time. You've always fluctuated. You've assessed your pain.
Yeah.
Do I need it today? Do I need it at this time? Can I manage? There's probably times where you might feel the slightest of pain, but you assess, is it worth taking 2 tablets for it, or can I manage?
Or sometimes I do take paracetamol alone.
Oh, okay,
Yes.
See. So that's a lot better. Dry mouth is quite common. Dry mouth is common. Some people even hallucinations with the strong opiates. Yes. So, if someone's being accused of being crazy, just double check.
Or paranoid.
Yeah, or paranoid. Just double check what's in their medication cabinet. Like I said, they all carry risk of dependence and addiction. And longer term side effects include falls, for men, erectile dysfunction. Infertility for women, depression, fatigue, and
mood swings.
Maybe mood swings. I mean, possibly mood swings. Definitely mood swings when people can't get their medication. I've noticed. Oh gosh, that's when you see another side of people.
Okay, thank you so much. We are still here on our Coco Africa Radio UK, and we are talking about pain management. I hope you are learning something. Please get your questions ready. We'll be coming to them soon. So, Geraldine, what do you do? What if medication is not helping? Like, is there any other way to manage pain without medication?
Yeah, so earlier I mentioned the non-pharmacological approach. So in the UK it's becoming quite popular. They're holding these mixture of physiotherapy and exercise classes because, like I was mentioning to you earlier, so I was talking about the brain signals, the signals to the brain to indicate pain. Those signals release a chemical called neurotransmitters. So you have good neurotransmitters and bad neurotransmitters. So when we do things like exercise, even just having a positive attitude, you've released good neurotransmitters.
Okay.
Medication also helps release good neurotransmitters. That's how you feel better. So with the bad neurotransmitters, it's negativity, feeling sad, depressed, and of course, if you've touched something hot, the only way the body protects itself is by sending those bad neurotransmitters. So something like exercise, it releases endorphins and good neurotransmitters. So funny enough, there is a psychological element to pain.
Okay.
Hence why there must be something, those people that can walk over hot coals, they're telling themselves something psychologically, and they're overcoming what probably you and I couldn't do. Because we'd just be thinking, this thing is hot, I need to get off, this thing is hot. But they've trained themselves in a psychological way as well to overcome that pain. So non-pharmacological approaches include exercise helps, massage, acupuncture, which is old traditional Chinese medication. I don't know if, there must be clinics back home that would do acupuncture.
Probably.
Because none of these things, I mean, they promote blood circulation, they help with the lymphatic system, and when an area is being rubbed enough, it decreases the inflammation, swelling, and things like that. So it can also release muscle spasm, muscle ache, and it also increases those endorphins being released, the good neurotransmitters. So acupuncture's, none of these things none of them carry any side effects, you know, and they may be expensive, but they're very beneficial. Hot and cold treatment as well, very effective. So a warm or a cold compress, depending on the injury, can be very effective. Studies have shown that there's reduction in pain in patients treated with active warming, cold therapy, applying a cool substance to any part of the body 2 or 3 times a day has shown to be very effective. So if you have a sprain on your ankle or anything like that, just applying ice is something I advise, and within days people are feeling better without having to douse themselves with a lot of medication. I don't know if you've heard of the TENS machine.
Yeah, the TENS machine.
Yeah.
Normally they give it to you when you are in labor.
Yes,
Yeah.
yes, and it works through electrical signals. So again, it's interfering with that network, that computer I was telling you about within the body. It produces analgesia, which is pain relief, by stimulating the fibers. So it's almost like it's distracting that network. It's distracting whatever message it's trying to send of pain. It's deferring it.
Okay.
So that's how TENS machines work. And of course, if there's a psychological element, like I was saying to you, therapy for some people, the way they think, go through cognitive behavioral therapy, stress reduction, those can all help. And of course, spirituality and religion. Yeah, some people have, you know, we hear it all the time, testimonies of people that have prayed, people that have focused on their faith, and they've managed to overcome severe pain. So there's other ways other than medication. Obviously, level of proof and studies aren't applied to those things, but it's always worth trying rather than always running to what can I buy to treat this. Yeah.
Would you say weight can attribute to like increase your pain, and so by losing some weight it can help manage your pain as well?
Yeah, as you can imagine, things like joint pain, you know, you're putting a lot of strain on your joints when you're overweight. So if you know you suffer from something like that long term, the goal would be to try and reduce weight, because naturally at least it might bring it to a pain you could tolerate more, if not disappear. So weight definitely is an affecting factor, but be careful as well. I've heard of a patient who thought they had bad acid reflux, and this is what I was saying, taking a full medical history and asking those questions is so important. They thought they suffered from heartburn, and they were just taking Nexium, Gaviscon over the counter, treating it, but didn't know in the background they were developing heart failure and angina. Yeah, angina that led to heart failure as well. And it's because no one ever asked them anything about when does the pain begin, when does it start, and they kept talking about this area. They didn't, but the person didn't really ask them where exactly. They just said, oh, here, I just feel uncomfortable here. So, I mean, the patient's still alive, they're okay, but just asking those important questions and not just self-medicating all the time is very important.
You know, what you're saying is actually true. I do have a stomach ulcer, so I'm on taking lansoprazole, and sometimes I use Gaviscon to help myself. And there was this time that I was having so much pain, and I kept taking the Gaviscon and the lansoprazole and all the other ones that I normally would take, but the pain was not going away, even with painkiller. Wow. It was not going away, and so I decided to check in at emergency, and it got worse there. I started throwing up. They checked, they did everything, they couldn't find anything. They asked me to go home. I said no, this is not right. because I've never had this much pain with all this medication. So I'm not going home. I decided to check myself in. I got on one of the beds over there.
How do you manage to check yourself in?
I said I'm not going home. So you know there are beds that they just push around. I saw one and I just sat on it and I said I'm not going home.
You said today I'm a patient.
Yeah, I said I'm not going home. I'm scared I was gonna die when I get home.
Oh.
So I'm not going home. And so they eventually realized that it was gallstones.
Oh.
But then there were similar symptoms. So you'll be there, you are treating something with some medication that you think that this is what's happening to me, but it's actually not that. And I had to do surgery to remove it, you know.
Yeah.
I would have just been home and then just be drinking Gaviscon all the time. Yes.
Yeah. Wow. That's powerful. I mean, another story similar to, it's funny, the stomach is more sensitive than we know, and it tells us a lot about what could be going on this region, the abdominal region. But yeah, it's a lady, she walked into the pharmacy and she was like, can I just have something for my stomach? And you know, if I was in a rush, I would have just given her some Pepto-Bismol and sent her on her way. But that day I was just, the symptoms she was giving me, there was time and I was just like, something doesn't sound right. So I started asking her, oh, how's your bowels? Like, are you getting bowel movement every day? She was like, yeah, it's okay. And then I asked her, but what color is, funny question, what color is the stools? And she said, oh, they're actually really dark. I said, I'm not selling you anything.
No.
You've had stomach pain for more than a week. You're telling me your stools are dark. Go to the hospital. And yeah, she was having an internal bleed.
Bleeding, yeah.
So if I hadn't asked that extra question and she had just told me I've got stomach ache and I was just in a rush, I would have sent her home with just some stomach Gaviscon or milk of magnesia or something. And God forbid what could have happened. So it's important.
Okay.
Yeah.
This is very interesting. Thank you so much, Geraldine.
No worries.
We are still here on our Coco Africa Radio UK, and we are talking about pain management. If you have a story, call us and let us know what your story is about. How are you managing your pain? Are you taking the right medication, or you are just buying something over the counter? Please be careful. Your life is important to us, so take the right medication. We are going for a break from our sponsors, and then we'll come back and ask your questions if we have any questions here for Geraldine.
Hey there, fabulous folks. Are you ready to take your locks to new heights of beauty and vitality? Then listen up, because Tiny Hands Locks is here to make your hair dreams a reality. Located at the heart of natural beauty, Tiny Hands Locks isn't just a salon, it's a sanctuary where your locks are pampered and celebrated. Now, let's talk about our top-notch hair care services and products. At Tiny Hands Locks, we believe in the power of nature's bounty to nurture and revitalize your locks. At Tiny Hands Locks, we are dedicated to crafting bespoke lock styles that enhance your natural beauty and reflect your unique personality. From starter locks to locks maintenance, we've got you covered every step of the way. And when it comes to products, we've curated a range of natural wonders that are sure to leave your hair feeling pampered and rejuvenated. From clarifying shampoos to revitalizing conditioners, each product is meticulously formulated with nature's finest ingredients to cleanse, nourish, and protect your locks. But wait, there's more. Visit our website at www.tinyhandslocks.co.uk to explore our full range of services and products. Located at 24 Swan Close, Feltham, TW13 6PA. Just give us a call at 0783 298 9531 and we'll take care of the rest. So what are you waiting for? Treat yourself to the luxury and care you deserve with Tiny Hands Locks. Because at Tiny Hands Locks, we're not just about hair, we're about empowering you to embrace your natural beauty and shine from within. Discover the magic of Tiny Hands Locks today. Hey there, fabulous folks. Are you ready to take your locks to new heights of beauty and vitality? Then listen up, because Tiny Hands Locks is here to make your hair dreams a reality. Located at the heart of natural beauty, Tiny Hands Locks isn't just a salon, it's a sanctuary where your locks are pampered and celebrated. Now, let's talk about our top-notch hair care services and products. At Tiny Hands Locks, we believe in the power of nature's bounty to nurture and revitalize your locks. At Tiny Hands Locks, we are dedicated to crafting this.
Hello, welcome back. We want to take this opportunity to wish Jay Patel happy birthday.
Happy birthday, Jay.
Enjoy your day and leave some of the cake for us on Monday, Jay.
Yeah, Jay, leave us some cake.
All right. Thank you. Okay. So we are back, and Geraldine, is there anything else you would like to add to it? Because we've got lots of questions here for you before we go into your questions.
Just out of interest, have you heard anything called phantom pain?
No.
So, you know how I was talking to you about the psychological element of pain? There's people that, for instance, if they've had an injury or long-term pain in an arm or a foot, and that has been amputated or it's been taken away or it's been operated on, the person can still feel pain months, if not years later in that area, even though technically it may not even be there, the actual limb they were talking about or area they were talking about, or the surgery has completely resolved it. So I just want to stress how much pain is to do with the brain and how we think about pain.
Okay.
So try remain positive if you're suffering from pain, and try and rely on non-pharmacological treatment. And of course, if you are going to take medication, try take the least amount possible.
Okay. Learn from me.
Exactly.
Don't take too much, but when you get fat like me too, you can take a little bit more. Anyway, thank you so much, Geraldine.
No worries.
I have a few questions for you. Okay. So this one is not a question. I think she's just adding on to what you're saying. IVNing, she said it comes with old age. So old age contributes to...
Yeah. Like I said, it's a risk factor. But don't assume, because like I said, there's 80 and 90-year-olds that I come across who technically, with the condition they're suffering from, or they're cancer-free patients, they've had cancer previously, or they have conditions like fibromyalgia, you would expect them to be on a lot more medication, or you'd expect them to be suffering all the time. But because their level of activity, their mindset, they're on very minimal, if anything at all.
Okay.
Compared to like a 20-year-old who, could be on 8 different pain medications and it's not touching it. So age, is a risk factor for pain, but it's not a determinant.
Okay.
Yeah.
All right. Thank you. And Ivianin again, she said great topic.
Thank you.
And great show.
Oh, thank you.
Asidalo said great show. Juliet Mills said very helpful.
Oh, thank you.
So today, I think you've answered most of their questions, so they are just happy with you.
Thank you.
Ivy Awaji said very helpful topic. Gloria Lomo said very educative, thank you. Juliet Roberta Anna is watching with you. Juliet is watching. Esther said, "Whoa, nice, thanks, very educative." It's mostly
Compliments.
compliments, yeah.
Thank you for the compliments, everyone, and thank you for
Yes.
listening.
Juliet said, "I have gallstones and have to take 30 milligram of codeine to help when the pain is really bad. Can gallstones disperse or come?" Let me see the question. Come out of your system some way. I only take the codeine when it's really bad, but would rather not.
Gallstones, I mean, it's after it's been assessed. I think there's medication that can help treat them, but sometimes it can be surgery. It has to be surgery with gallstones. But I know the surgery is quite effective.
Yeah.
Because afterwards people don't really rely on the medication to deal with the pain anymore.
Yes.
So definitely worth talking to a healthcare professional about your options, because having to remain on codeine long term it's not fun, I can imagine.
No.
Yeah.
Yeah, I had mine removed. I think when it's removed is the best. Yeah. Because even if it moves and then the pain goes away, it just comes back again. Yeah. Okay. Okay, Juliet, that's your answer. Don't worry, your surgery date will be here soon. Abigail Edu, she said, I went to the gym and started having pain around my ankle and thigh. The pain has been there for more than a week. Kindly note I'm regular at the gym and it's only first time I'm regular at the gym and it's only my first time experiencing this. How do I manage this pain?
Where is it? Ankle
and thigh.
And where?
The thigh.
Oh, ankle and thigh. Okay.
Yeah.
In one leg.
Yes.
Okay.
I assumed.
I don't know. In that case, it might be repetitive strain, or there could be in the thigh. I don't know if she's torn a ligament. That if it's just been a week, it can take. Like I said, acute pain can last anything from a few days to up to 3 months.
Okay.
So depending on it, if she was to, is she taking any medication?
I'm not sure. She didn't mention that.
Like I mentioned, hot and cold compresses are quite effective. In her case, ankle, I definitely recommend a cold compress daily. When she has time, if she's on her bed or watching TV, at least 15 minutes a day, just resting that on her ankle. And then giving it up to about 8 weeks before she assesses if it requires an X-ray or anything like that. And then taking things like paracetamol and ibuprofen combined, as long as she's safe to take ibuprofen. Because it sounds like either repetitive strain, if she's because my first thought was if she's new to the gym, with gym you have to be careful that you're not in the wrong posture or positioning. If you're doing weights or anything like that your body's not used to, or you start sprinting and you've just given a shock to the system, or you've strained something, then you can end up with an injury. But she's a regular. I assume she knows all of that. It sounds like she could have torn something or sprained something. Cold compress on the ankle, definitely 15 minutes a day, keeping it elevated. With the thigh, ibuprofen will help with that, and paracetamol, and reassess after about 8 weeks. Yeah.
Okay. I hope you've got your answer, Abigail. Okay, she said I'm using deep heat for now.
Okay.
All right.
On the ankle, I don't know if that's... It's funny, depending on where the pain is. Sometimes cold is better, sometimes. I know with ankle, cold is normally more recommended.
Okay.
Deep heat on the thigh probably makes sense.
Okay.
If she's feeling the pain in her thigh muscle, then deep heat should help with that, as well as adding the ibuprofen.
Okay.
But on the ankle, go more for cold application.
Okay.
Yeah.
So Abigail, use the deep heat, like she said, on your thigh, and then you get cold for your ankle. Juliet said yes, it does help, and I'm waiting on that. So thanks so very much. Yeah, I don't know if I have any more questions on YouTube as well. Let me see. When you are looking for them, you can find them. Okay, so somebody says hello there.
Hello.
Juliet was there. She said hello. Joseph said good afternoon, my dear sister. Good afternoon, Joseph. So there is no more questions here. All right. So we finished your questions. You have questions for us as well.
Yeah.
Okay.
I like to make it interesting and put you on the hot seat from time to time.
Now I'm gonna throw the questions out to them because we've all been listening to it, and I think I've been doing all the talking, so they have to say something as well.
True.
Okay, let me see. Did someone write something again? Okay, Ivy said lessons well learned, so she's ready to answer questions.
Okay.
Ivy, don't go away. All right, let's start with the questions you have for us.
Okay, so which of the following is the difference between acute and chronic pain? Chronic pain is long lasting. Acute pain is long lasting. Chronic pain is short acting. Acute pain requires prescription medication.
I think chronic pain is long lasting.
And how do we categorize how do we separate chronic pain from acute pain?
So acute pain goes away after a period of time, but chronic pain stays longer or stay with you for forever or what?
Do you remember the time that we would say, okay, this is starting to look like chronic pain? The time period?
No.
No. It was... Did anyone answer?
No.
No?
They are keeping quiet.
They're not helping. 3 months.
3 months, that's for
Acute.
acute, okay.
Yes, anything more than 3 months, we would start to wonder if it's entering the chronic pain.
All right.
Yeah. Which of the following is a risk of using prescription pain medications to manage chronic pain? There is a risk of the patient developing habitual abuse of painkillers. Prescription pain medications are only appropriate for treating acute pain. Prescription pain medication takes away a patient's eligibility for interdisciplinary approaches. Prescribed pain medication offers no additional risks to the patient.
I think the first answer, I think that's the answer.
Yeah.
Like getting addicted or something, yeah.
Yes. Yes. Okay.
Let me see. Oh, Juliet said 8 weeks. I think she's referring to...
Oh, okay. No, I was Juliet, that was applied to your specific injury, but you're right, that's still in the acute pain area. But when we'd start to worry about chronic is if it went beyond 3 months.
Okay.
Yeah.
All right. Okay, next question.
The next question is, what step in the World Health Organization pain ladder would you find tramadol?
I think step 2.
Yes.
Hey!
Okay.
Okay, Abigail came back. I think your other question, she said the first answer is the right answer. Well done, Abigail.
Okay. So this is your last question.
Okay.
How many people are said to be suffering from chronic pain? What's the statistic? Not how many quantity, but what's the statistic?
Is it possible what that says?
Oh, yeah. 1 in 10. 1 in 50. 1 in 5.
Is it 1 in 5? Yay!
She's constantly scoring 100% on my quizzes. I need to...
Yes!
Yeah, I need to figure it out.
Oh, so that's the last question.
Yes.
All right. So, anything else you want to tell us before we leave?
I think just if people are interested in other subjects, I can try and... I mean, as a pharmacist, I do look more at medication, but I don't mind trying to study and understand conditions more and linking it to the medication. So if there's any areas of interest, just let me know. Give me enough time and I can come and speak on what I've learned and my experiences. So just wanted to say that if people have any area of interest, to just let us know.
Okay. All right. Thank you so much.
Thank you.
Thank you for this interesting topic, and thank you for the education you're giving us today. We've learned so much. Even me now, I know how many paracetamol I can take.
That's good.
So we are so grateful for you for coming back.
Thank you.
We appreciate that, and we hope you will come back soon.
Yes.
Guys, bring your topics and let's see Geraldine here. The earlier you bring the topic, the earlier she comes back. Okay? So thanks so much, and this is bye from us on Akoko Africa Radio UK.
Take care, everyone.
See you soon. Hello everyone. Thank you for staying with us. I hope you've learned something today. Last time Geraldine told us about antibiotic, how you can get resistant to it and it will stop working, and the same thing applies to painkillers. If you can stay without a medication with the pain, if you can endure it, please try and stay without it. If you can't, start with paracetamol. If it's getting too much, get advice from a doctor or someone who can help you, and don't just be taking medications over the counter for pain. Like she said, you can get addicted to it and it will get to a time it will stop working. So please and please, all we are trying to do here is to educate, because everybody's life matters and we need everyone alive. So if you are not able to listen to this today, you can always go back on our channels. We are on YouTube, Facebook, and on the radio itself. You can always go back and listen to it. If you find something and you don't understand, you need some answers, you can always send us messages and we'll come back and answer your questions. We are always here for you, and I hope you've learned something today. Thank you so much.
Hey there, fabulous folks. Are you ready to take your locks to new heights of beauty and vitality?
I was talking
Then
to
listen up.
a friend I've not seen for a long time today, and then he asked me, how are you doing? And I said, I'm managing. In our language in Ghana, I say, how do you say it in Ghana? I said it in Ghana. I was like, Abodantwe. So we are managing. And then he said, no, you don't have to say that, because somebody wish they were like you. If you say you are managing, it means you don't have options. But you have options. Somebody wish they are alive today. Somebody is in pain. Somebody doesn't have food to eat. Somebody doesn't have anywhere to sleep. But you have that. And so you have to be grateful for whatever you have. It's not I'm managing, but I'll say I'm blessed. I'm alive. I'm here. And I know the sun will rise in the morning, that there is light at the end of every tunnel. Whatever the situation is, morning will come and the sun will come and you'll be happy. So in whatever situation or whatever you are going through, somebody wish they are like you. So be grateful and appreciate. We've learned today that even with pain, you can manage that with your positivity. So let's be positive, whatever it is, and everything will be fine. From all of us here at Akoko Africa Radio UK, we wish you a nice weekend. Tomorrow, there will be Shepherd's Hour with AC. Please be prepared for her. You know she's audacious. She will bring you something powerful tomorrow. So let's wait for her tomorrow. Don't go anywhere. And if you miss it, like I said, always go back to our channels and listen to it. Thank you so much and have a very, very pleasant weekend. Bye from us now. Bye.